This presentation contains additional information which is specific to infants less than 44 weeks corrected gestational age. Investigators should view this presentation alongside the other recovery training materials. Transmission of COVID-19 from a mother to her unborn baby is very unlikely, and there is a low risk of babies being infected at birth, even if born to a confirmed COVID-19 positive mother. Infection in the neonatal period, that is less than 28 days of age, has been described, but is very rare. The majority of babies who develop COVID-19 present with mild symptoms or are asymptomatic. Babies with symptoms may present days to weeks after birth. Up to the age of 44 weeks corrected gestational age, clinicians may choose to treat infants of any gestation on the basis of clinical signs alone if there's a high index of suspicion for COVID-19 infection. This may especially be the case where clinical deterioration is not explained by existing neonatal conditions. Where the cause of the clinical deterioration or collapse is unknown, the possibility of COVID-19 infection should be considered. For the few infants who develop suspected or confirmed infection, a robust evidence base is essential to guide the use of effective treatments and to avoid potential harm from severe or life-threatening disease. The Royal College of Paediatrics and Child Health recommend that treatments for COVID-19 should only be used in the context of a treatment trial. It is anticipated that any child with suspicion of COVID-19 being considered for treatment over and above supportive care should be enrolled in the recovery trial. Criteria for treating infants who are less than 44 weeks corrected gestational age include the following. These should also be considered as criteria for entry to recovery for these same infants. An increase in respiratory support to maintain oxygen saturations within accepted limits, that is new or above a baby's previous baseline. Signs of sepsis with shock, encephalopathy, multi-organ failure. Patient information leaflets and consent. Parents of infants and children less than 10 years of age should be provided with the younger child's information leaflet. The parent or guardian should sign the consent form. Witness consent may be obtained over the telephone or using web video link if hospital visiting rules or parental infection mean that a parent or guardian cannot physically be present. Treatments available for infants less than 44 weeks corrected gestational age. For the first stage interventions, the options available to these babies include azithromycin, hydrocortisone or no additional treatment within randomization 1A. Within randomization 1B, these infants are also eligible for convalescent plasma versus no additional treatment. The hydrocortisone option is specific to infants less than 44 weeks corrected gestational age and is not available to older infants and children. The second randomization to tocilizumab versus no additional treatment is also not available to children less than 1 year of age. Specific neonatal and paediatric drug dosing and administration guidance is available in the Frequently Asked Questions document on the Recovery website.